Hi, everyone. Thanks for joining me. My name is Lindsay. I'm a registered nurse. If you don't know who I am, I'm going to link a video below in the description that will give you the introduction of who I am. Also, stick around until the end because I have very exciting information for you that I really want you to see. So today we're going to be talking about dementia and Alzheimer's. And I found this information. There's a 90-page document from the Alzheimer's Association. So I'll link that in the description below also, but I'm going to give you the Cliff Notes version of it. And I'm going to do it over a couple of videos because it's so long. So today I want to talk about the symptoms and the brain changes of dementia and Alzheimer's patients. So for the Alzheimer's Facts and Figures sheet of 2019, which was just last year, they have said that 20 years or more before symptoms appear, the brain starts to change and the changes of Alzheimer's may begin. So that's extremely significant because that could mean 20 years prior to them having symptoms, their brain was starting to change. So if you're 65 and you're having symptoms, or you're in your 60s having symptoms, that means that 20 years ago, so when you were in your 40s, the brain had started to change. Or when you are in your 80s and you were diagnosed, that means you were in your 60s when the brain started to change. So if you are watching this, if you have a loved one that has dementia, start to think back. If you have been with them for that long, start to think back about 20 years ago. Is there anything that you could see that would correlate to them, like forgetting just like little subtle things, or anything that you found was like off for them when they were 20 years ago when they were a little bit younger? If you have a story, comment below and then I will take a look at it. So I want to go over some of these things. Again, there are 90 pages, so I'm just going to give you a little cliff notes of what Alzheimer's is. And again, this is from the Alzheimer's Facts and Figures of 2019. So Alzheimer's disease is the type of brain disease, just like coronary artery disease is of the heart. So it's a degenerative disease, meaning that it becomes worse over time. So in a recent study of people, they found that there are levels higher in the brain. So the levels of beta amyloid are higher in the brain of Alzheimer's people than they are of any other type of people. So when you have early changes in Alzheimer's occur, the brain initially compensates for them. So meaning, like, if they have damage to the nerves or the cells, it will compensate and bring different nerves and different cells in to your brain that will function kind of like if there was a bridge and the bridge fell down, you would go over a different bridge because that bridge is no longer there. So the brain it's very smart, and the brain does start to compensate. But along the way, as damage to the nerves gets worse, then there are obviously signs of cognitive decline that happen. And then you'll see behavioral symptoms, such as markers that they can test for to say that you have diabetes. So the same thing with Alzheimer's disease. So in mild cognitive changes, there is biomarker evidence, the elevated levels of beta amyloid in a PET scan of your brain. So they'll do a PET scan, and they have biomarkers that say that the elevated levels of beta amyloid are congruent with the fact that there's cognitive decline, and then you can diagnose for dementia. So this is increasingly significant. Approximately 15 to 20% of people age 65 or older have mild cognitive changes from any cause, but especially including memory problems, are more likely to develop Alzheimer's disease or another type of dementia. So if you have mild cognitive changes because you have diabetes and it's starting to affect your brain, or if you had a traumatic brain injury, or if you have depression and you have a lot of stress on you, any slight difference of cognitive changes, about 15 to 20% of the people start to develop dementia later in life. So that's very significant. Now, dementia due to Alzheimer's is characterized by noticeable memory changes, thinking, and behavior symptoms that impair the person's ability to function in their daily life. Well, obviously. So if you have a person or a loved one that you have that has noticeable memory, thinking, and behavioral changes, that decreases the ability to function, then that is dementia, which I'm sure that you guys already know or are experiencing right now. For the mild, there's 3 stages of dementia. There's mild, moderate, and severe. I did a more lengthy video on the mild, moderate, and severe stages, so I will link that in the description below also. So for the mild stages, most people function independently. They may require some assistance on some things. It kind of just depends, but mostly they are independent. Very, very mild stages. Now in the moderate stages, they may have difficulty communicating, so they may forget words or may forget your name or may forget how to drive. They may need help doing activities of daily living, such as bathing and dressing. They could become incontinent in times or start having changes in their personality or behavioral changes, including suspiciousness and agitation. So that's another thing to watch for, because sometimes their personality really changes. Where they can start suspecting that you're stealing from them, or there's people in the room that are there, they're hallucinating, but you don't see them, but they think that it's real. So you have to watch out for that and make sure that you talk to the doctor about that, their regular doctor, and they can prescribe some medication for that. So the last stage in Alzheimer's is the severe stage, where they become bedbound. The damage in the areas of the brain is so significant that they cannot function at all anymore. So they could develop blood clots, skin infections, sepsis, because it's triggered by the body's inflammatory response, because their organs are failing. They may not be able to control their swallowing. It may be difficult to eat and drink, or they just stop eating or drinking at all, period, because they forget how to swallow. It's a really, really bad disease, and very sad. So here we go with some of the signs and symptoms. You can have memory loss that disrupts your daily living. Sometimes the memory loss is very significant. Sometimes it is very, very minute. In the very early stages, the memory loss can be very minute, like just forgetting where you placed your keys, or forgetting their purse, or forgetting their wallet is inside of their purse, things like that. They may have challenges of planning and solving problems. Like if they, had to use the telephone and they forgot how to push the numbers or what the numbers were, or if they need help with their monthly bills. They may sometimes have difficulty completing familiar tasks at home, like cooking, making sure that the burners are off. That's a very significant one. They may have confusion for time and place. They may not know that it's winter time and think it's summertime outside. By the way, they are always cold, no matter whether it is, 110 degrees or whether it's 25 degrees. It's because when older people get older, their blood, they're not moving as much, and their blood is just not being worked as much, and they just get very cold, very fragile, very cold, very easily. So sometimes they have trouble understanding the visual images, so they could forget what color or contrast certain things are. They may have problems forgetting what their dog's name is or their child's name. They misplace a lot of things a lot of times, especially like the remote. The remote can end up in like the garbage, or in the dishwasher, or in the refrigerator for some reason or another. They have poor judgment, meaning that they don't know like how to manage money anymore. They may withdraw from social activities or from work. Hopefully they're not working at this point. But if they are, you would notice a lot of significant changes in working and trying to figure out, what their schedules are, things like that. And changes in mood and personality are a big, big one. Okay, so here's what I want you to know. 5.8 million Americans are living with Alzheimer's dementia today. So there are 7 billion people on this earth, and 5.8 million of them have dementia. That's a very huge number, especially with the dementia population. Now, obviously, 7 billion people compared to 5.8 million might seem like a small percentage in the long run, but it's a very huge percentage. 5.8 million people are living with dementia. That's so significant. So when we take a look at the prevalence of Alzheimer's and other dementias in the United States, there is an estimate of 5.6 million people ages 65 and older, and approximately 200,000 of 65 and under living with younger onset Alzheimer's. So Alzheimer's tends to affect women more than men. So 1 in 10 of age 65 and older has Alzheimer's disease. It's 1 in 10 for men and it's 1 in 20 for men and 1 in 10 for women. So women have a higher basis of having Alzheimer's disease. And I feel like, this is just my opinion, that women have more of a burden of stress on us. So I don't doubt that there are a lot more women living with dementia as it affects the brain, because there's so much stress on us as women. Again, just my opinion. There's a lot of men that have a lot of stress, but women tend to take the burden of trying to take care of everyone and neglecting themselves. And it's very hard when you get older, because your brain does start to change. Now, here's something that's significant. Although there's more non-Hispanic whites living with Alzheimer's and other dementias than any other race, older Black/African Americans and Hispanics are more likely on a per capita basis than older whites to have Alzheimer's and other dementias. So more studies indicate that older Black African Americans are about twice as likely to have Alzheimer's than other dementias than whites. And Hispanics are about 1 to 1.5 times more likely to have Alzheimer's and other dementias than older whites. Okay, so here's something significant. By 2025, the number of people aged 65 and older with Alzheimer's dementia is projected to reach 7.1 million. So we're talking about over 6 years, from 2019 to 2025, it's going to grow to 2 million people more will have Alzheimer's. And then by 2050, the number of people 65 and older may projected to grow 13.8 million. That's over 25 years. They're talking about a projection. So it's not, it may not be true or not. They're just projecting it with the way that it's going. Or if they are developing more medical breakthroughs to prevent or slow or cure Alzheimer's disease. So right now, obviously, it is not curable. Okay, so lastly, I want to talk about the long-term care and costs of healthcare and hospice and things like that. So there's an estimate $2.9 billion is spent on Alzheimer's and dementias in healthcare, long-term care, and hospice care in 2019. So because we have a lot of dementia patients that have a lot of other chronic issues, such as falls and trauma, ischemic heart disease, which is a heart attack, gastrointestinal disease and issues, pneumonia, delirium, mental changes, and statuses. So it does get costly to treat people with Alzheimer's, but that's not what I wanted to talk about. I wanted to talk about the options that you have when you have somebody that has dementia. If you are trying to take care of them in home, if you need to go to the doctors, you can have like an urgent care. Most older people have inpatient hospitalizations. They can go to their doctor's office, a skilled nursing facility, which is like an assisted living, a nursing home, or a rehab. nursing home, hospice, home health care is most prevalent for the cost of having a Alzheimer's or dementia patient. So another part of this is the percentage of Medicare beneficiaries aged 65 and older with Alzheimer's who also have coexisting conditions, which could be CAD, which is coronary artery disease, which is where your arteries get blocked from your heart. A lot of older people have diabetes, or chronic kidney disease is another huge one because your kidneys are not filtering out. You're not drinking enough. You're getting dehydrated. You're on medications. You're not filtering out through your body. And you develop chronic kidney disease, especially with coronary artery disease, because the arteries in your heart get blocked and they all connect in together. And you develop chronic kidney disease because the arteries in your heart are blocked, which blocks the arteries in your kidneys. You can have chronic obstructive pulmonary disease, which is COPD, from chronic bronchitis, pneumonia, or because you're a smoker, you develop chronic obstructive pulmonary disease, COPD. Stroke and cancer is another big one. So for older people, you do have options to use long-term care settings. So adult daycare. I used to work at adult daycare. I love adult daycare. So 69% of adult daycare services offer specific programs for individuals for Alzheimer's or other dementias. So I don't know how many adult daycares there are around now. You have to kind of look in your area. I know in my area, there's only 2 that are functioning right now. The one I worked at went out of business because they ended up, because of the way that Medicare and Medicaid reimbursed them, they ended up spending a lot more to facilitate these individuals than they were bringing in the money. So it's, you know, unfortunately it is a business, and I guess they made, I mean, I don't know, I was just a CNA at the time, but I guess their business decision was to shut it down. So then there's also residential care facilities. 42% of residents in the care facilities, which includes housing to assist with everyday activities. So I worked at an assisted living, which we had 2 houses. One was a locked facility, and now it sounds bad, but they just had a code, a passcode that you had to get in so that the dementia patients that had no clue where they were could not escape out. And then we had another house that was for just older people that needed help, needed somewhere to live, needed some kind of help with their bathing and medications, but didn't need that much help. They were still able to be independent. And then the last is nursing home facilities. So 50% of nursing home residents in 2014 had Alzheimer's. So about half of them had Alzheimer's. Okay, so just as a cost estimate, if you have not seen these costs before, home care usually costs about $22 per hour, $132 per day. Kind of depends on where you live, whether you live in a high cost of living area or whether you live in a low cost of living area. So I'm kind of in between, and I worked for a home care agency that we charged $23 per hour. So this is pretty right on target. Adult daycare centers, so the one I worked at, I remember they did it was $72 per day. So that's right on target there. Also, it depends on whether you live in a high cost of living area, low cost of living area. So the one that is closest to me that is now operational, they take dementia patients that have all kinds of significant medical issues, like they have a trachea or they have huge wound care things going on. And so I definitely know that their cost of per day services is a lot higher than $72 per day. But again, it depends on where you go. So assisted living facilities, $4,000 per month. That's pretty right on target, but for where I live. But again, it depends on what your area's cost of living is. The next closest to me, I think they charge about $8,000 per month, but their facilities are incredibly sophisticated, high dollar facilities. So you're getting, a lot of amenities for the adults that are functioning still and independent that just need a little help. You're getting a whole lot of amenities there, and their cost of living per month is a lot higher. Nursing homes, $275 per day. I'm not sure what the cost of it was for when I worked at the nursing home, because we didn't know about that stuff. I just heard it through the grapevine that it was about $300 per day. So again, that's kind of on target. I think it depends on the city that you're in, and also for the nursing homes, I'll have to find the website, but you can go on a website to see what the facility, whether it's like a 5-star facility, 4-star facility, 3-star facility. So the nursing home that I worked at, I chose to apply for that nursing home because they were a 4-star facility, which is really, really good considering it's a nursing home, because most nursing homes tend to have very low ratings. So they started out as a 4-star facility, and I worked there. And it was very chaotic, and I'm not really sure what happened because I only worked there. It was called PRN, which is as needed. I would work on the weekends, but they went from a 4-star facility to a 1.5-star facility, which is a significant drop, which means that they got fined a lot from the state, and they also lost a lot of other funding that they had. So I know we had a lot of meetings surrounding it, but I decided to stop working there after that. So it just depends on where you go. Make sure you look at what the nursing home is rated as. It's never going to be perfect if you go to a nursing home because there's such a high demand. There's a lot of staffing issues, and there's a lot of people and patients versus staff members. So it's never going to be perfect. Just make sure that you choose a nursing home that is, around the location of your area so that you have full access to them, and make sure you go in there and interview and see how, see what the overall feel is and see what they're rated on. Okay, so that is a nice segue to end this because I have given you so much free information, and I'm so thankful that you guys watched. Please join my free dementia group below. I give a lot of information in that group, and I'm also so excited to announce that I'll be doing group coaching for 6 months for dementia caregivers. So this is a way to really get in depth with me and go over some of the things that you're experiencing at home with your dementia loved one, and also for yourself, because you can't give the most to your dementia loved one if you're depleted. So for me, I've had 14 years of dementia experience as a CNA before, and then I became an RN. I'm going to be holding weekly Zoom meetings that are 1 to 2 hours of coaching every Wednesday night that is personalized to your situation. I'll be reviewing your specific situation and how I can help be most beneficial to you, reviewing your loved one's plan of care or medications. You'll get support from one another and going through this, people that are going through the same thing. And the biggest thing that I want you to know, again, is it's personalized coaching for you, because you cannot help your dementia loved one if you are depleted. So you need time for yourself. And this is what I have seen that is mostly the same for every person that's taking care of their dementia loved one, is that there's no time for themselves, and they are exhausted, and they're taking everything and caring for someone else. It's kind of like caring for a child, but they're bigger, stronger, older, they have a mouth on them, and they're having changes in their brain that sometimes they can't help. And even though they ask the same question 5,000 times, or they're seeing dead people that you don't see, or they're becoming psychotic, or they're becoming frustrated and angry and agitated and mean, all of that stress burdens you, and you're the one that it falls on. So in order to keep from, having the whole stressful situation, I have developed a group coaching session that I'm going to do for 6 months, because I have found that this is the most significant thing that I have seen, is that the people that are caring for their dementia loved ones have no time for themselves. And again, you cannot fully be present with your dementia loved one and care for them if you're not caring for yourself. So if you would like to be put on my list, I haven't developed the landing page for that yet in the email list, but if you would like to be put on my list, please comment below and I will put you on the list so that you can have first dibs when I roll this coaching program out. I'm only going to be taking so many people because I want to give you specialized individual attention. So if you would like to be put on that list, comment below, and thank you for watching.